I had a patient of mine who came in the other day in her 60s, and I started talking to her about her subjective complaints. And it turns out ever since she was in high school, she's had trouble with shin splints. Let's talk about shin splints. There's a lot of different reasons why you might have lateral anterior pain, but a common thing that I would always check if you were having any type of lateral knee pain or pain along the top of the foot or even into the big toe is a trigger point in, well, I'll tell you in just a second. Welcome to the front row. If this is your first video, we've got you covered. Everything from headaches down to back pain, down to foot pain. Remember to go to the search bar, type in what you're looking for. If you don't see it, please let me know, and maybe I'll make a video for it. In this video, we're going to talk about trigger points of the anterior tibialis. I always check that for any type of shin splints or any type of lateral knee or ankle pain, top of the ankle, or even big toe pain. The location of the anterior tibialis trigger points. It tends to be on the outside, high up here, surprisingly, just below the knee. It can give you referred pain all the way down this outside edge into the top of the ankle and even to the big toe. Sometimes I've had patients that have had the diagnosis of gout, but they don't quite fit the clinical picture. So I always say, hey, you got nothing to lose by checking the anterior tibialis. A couple different ways you can work it. Literally with the pads of your fingers, you can come in through here and you can search, and where you find that trigger point, enough pressure to be a little face cringing on there, and then it's about a minute per sore spot. And then what I would do is I would work that even a couple times a day until you feel like that soreness starts to kind of abate a little bit into that area. Another way to work it is with a Theracane. I like to use these knobs here. This one's a little bit awkward for me. And I can come right into here and put a little bit of pressure down into it and work it that way. I've had some patients that are flexible enough. They like to use their opposite heel and dig their opposite heel up and down this lateral area of this fibula. Anything that's sore, they tend to work it a little bit more. You can also try the peanut, which is just two tennis balls taped together. Be creative with it. Find a way to put a little pressure on that outside edge, and then you can roll it back and forth. Whatever way you decide, just make sure that you stay with it consistently, preferably 4 or 5 times, 6 times even in a week, until that tenderness starts to release a little bit and starts to get better, and then check to see if that correlates with some of your pain. If you haven't subscribed to the channel, please do so. I'd love to hit 10,000 subs by the end of 2020. Please give the video a thumbs up if you found it helpful. Any questions or any videos you want to see, please leave them down below. Good luck.